Hi Jeff, it's Dr. Buford. We're just getting started on your right shoulder. We're looking in from the back to the front. Your shoulder was stable under anesthesia, no signs of any instability, and you're laying on your side here. So this look that we have is with your arm up in the air, so the humeral head is at the top of the screen, and the glenoid or the socket is down below. And we can see that it looks pretty good. There's no significant loss of cartilage on the glenoid. The humeral head looks pretty good. I'm going to come up here and look at the biceps tendon, which is this structure here. No significant injury to the biceps. We can see how the biceps anchor here. Looks good. No signs of any problem there. We'll look up at the rotator cuff, which is above the gray cannula. The cannula there is about the size of a pencil, maybe a little bit bigger, but that just gives you an idea of the magnification that we're working under, about 30 or 40 times. So the rotator cuff is inserting there normally. That looks great. We can follow this all the way around the back of the shoulder. That's the normal bare area of the shoulder. Here's posterior capsule. A little bit of fraying in the posterior inferior labrum, but that's less than 2 millimeters. That's really, really small, microscopic almost. Normal changes for as athletic and hard charging and active as you are, and not the reason we're here today. Here's the subscapularis tendon. I'm touching it right here. That's the superior edge of the subscap. This is the middle glenohumeral ligament right here, crossing the subscap. That's the middle glenohumeral ligament. It's inserting into the anterior labrum here. And as we, can you do that for me? As we lift up and pull back on the shoulder a little bit, we can look down at the bottom and see the anterior band of the inferior glenohumeral ligament and the anterior capsule down below. So this anatomy is checking out very well. I'm happy with this. We're going to keep looking around. If there's anything surgical we have to do here, we'll come back up on the video. Okay, so we've changed positions now. We're up above the rotator cuff in a part of the shoulder called the subacromial space. This is where we do our bony decompression. That's actually the clavicle right there. We'll look more at that in a minute. And we'll keep this cannula in. Okay, so there's one more anterior cannula that we're going to place into the subacromial space from the right side of the screen here. There you see it there. Go ahead and pull out the, okay. And now we're going to start to have a look. We've already taken off a little bit of bone. The back of your shoulder is the left side of the screen, so this instrument you see here is coming in from the back of your shoulder. And so we've taken off a little bit of bone laterally here. And now we're going to rotate the camera. We'll clean the scope for just a minute and show you some more. Okay, so what we've got here is the burr coming in from the back. Just for orientation, that's your clavicle. So this right here at the tip of the burr is the AC joint. That's the clavicle right there. This is acromion, that's clavicle. Remember, this is your right shoulder, so we're looking from the lateral side. So we're going to make sure there's nothing impinging on the top of the rotator cuff anymore. We've already taken off a little bit of a downward slope, and so you can see how to properly do this. We don't have to take a lot of bone off. We just want to make sure it's flat. And as I pull back, we can see there's plenty of space here between the rotator cuff and the acromion. That looks good. And so now we can start the decompression on the clavicle, even from the posterior approach here. You can see once we cut the bone, it gets kind of a yellowish appearance to it. We want to take off about 7 or 8 millimeters of the clavicle. Sometimes you take 1 or 2 millimeters off the acromion as well, if necessary, to do the decompression. Okay, we'll show you some more in a minute. Okay, so now we have a slightly different view. The burr is coming in from the front of your shoulder, so that's your clavicle on the right and the acromion on the left. I like this view because we can see the entire AC joint. So here's the anterior edge of the clavicle here on the right, posterior clavicle right there. Acromion on the left. I want to make sure we get all the way to the back of the joint and all the way to the top. So we're almost done here, because as I push on the clavicle I can see that we have good space here. We can measure using the width of our burr as a guide. We can even look up towards the top and we can see that we've got pretty good space here. That's the cut edge of the clavicle. Maybe a little bit of acromion I can remove right here. Okay, so we're going to show you some more just a little bit. We're almost done. Okay, so I think we're done here. We've got plenty of space all the way to the back of the joint. And we can see all the way to the top there. See that? That's the top of the clavicle there. So good luck to you now. I really hope this does the trick for you. I should mention that your rotator cuff was perfect on this side as well, so there was no rotator cuff pathology that we had to worry about. And I think we can just clean up and get you back to the recovery room. Get some stitches in, a couple Band-Aids, and a sling, okay? So good luck to you now. Bye-bye. See the shaver.